So I'm checking the patient's orders along with the Mars. I do see that the doctor has prescribed the patient receive Tomoptic 0.51 drop in the left eye daily, Tomoptic 0.51 drop in the left eye daily. I'm checking for the right patient, right route, right medication, right time, and right dosage. I'll now perform my second check. Have Tomoptic 0.5 drop in the left eye daily, Tomoptic 0.5 in the left, 1 drop in the left eye daily. Knock, knock, knock. How you doing today, Mr. Jones? My name is Tiffany. I'm your nurse today. Would you mind if I take a look at your bracelet for me? Your ID bracelet? All right. Could you please verify your full name for me and your date of birth? And do you have any known allergies? Okay, great. I'll now provide privacy for my patient. Perform hand hygiene. So, Mr. Johnson, the doctor has prescribed that you receive Tomoptic 0.5 in your left eye, 1 drop in your left eye daily. Tomoptic is used to treat open angular glaucoma and any other forms of ocular hypertensive in your eye. Are you currently taking any type of hypertensive medications already? Okay. I ask that because when you do so, it could give you the risk of bradycardia and hypotension. So to be on the safe side, I will establish a baseline by by assessing your atrial pulse and your high blood pressure. I raise the bed up to a working range. I check the patient's atrial pulse. Okay. I'm listening to I've located the patient atrial pulse. I will listen for 60 seconds. In a hospital setting, but for video purposes, I'll listen for 30 seconds and multiply by 2, and that will give me the atrial pulse. Okay, 30 seconds has passed. The patient's pulse is pretty strong. All right, I'll now check the patient's blood pressure to make sure that it's not too low in order to administer medication, because if the patient has an adverse effect and his blood pressure is already low, the medicine could possibly cause it to be lower, which put the patient at further risk for safety and injury. The patient's blood pressure is normal. It's not too low, so I can't administer the medication. I will let you know also, Mr. Johnson, that after taking the medication, you may receive some side effects of itchiness, burningness, or redness in the eye. Okay. That should not last long. If it does get out of hand, I'll give you my call after finishing the medication. You give me a call back, I'll come to assist you, okay? I'll now perform my third check. Tomoptic 0.5, 1 drop in the left eye daily. Tomoptic 0.5, 1 drop in the left eye daily. It is the right patient, right route, right dosage, right time. Also, the medication is usable because it is it has not expired. I'll perform hand hygiene once more. I'll put on my gloves. I now administer medication. I ask the patient to lift his head up to look at the ceiling. Mr. Johnson, could you look up at the ceiling for me? And I'm going to lower your lower lens and place one drop of the Tomoptic in your left conjunctive sac. Okay? And I'm going to hold your eyelid down for about 30 seconds to make sure that we have maximum absorption. Okay. 30 seconds has passed. All right, Mr. Johnson, I'm going to leave you your head elevated for a couple more minutes. That does complete the medicine administration. I'm going to lower your bed back down for you. Making sure that the arm rails are up by 2. The bed is locked. I'm going to dispose of my gloves. Mr. Johnson, if you do need me, I'll give you my call light. I'll be back to check on you in about 30 minutes. I will now document my administration and come back and check on the patient, okay? And that completes today's administration.